There has been a long debate over the effectiveness of mammograms, especially in the past year or so. But yesterday, the longest running breast cancer screening study came out, and its results show mammograms do work and they can help cut cancer deaths by at least a third. Dr. Bernard Chinnasami is an oncologist at the Hayworth Cancer Center. He joins us now to talk more about that study and the results. And I got to tell you, I was pleased to see this come out because I was hoping that it might encourage women, younger women, to get mammograms.
I think putting women in charge of their health is the single most important thing. The big confusion came up when the American Cancer Society and the U.S. Preventive Task Force sort of disagreed on prevention studies. And I think the last thing we ever need is for two big groups to disagree, because it only precludes people from doing things they ought to be doing. This study, I think, is a great study. It's a large study, over 100,000 people. And basically, they looked at women starting age 40 and up to age 74. And they did find that even in the group where we thought that maybe mammograms are not as beneficial, in the age group at 40 to 49, it did show a benefit. So I think that's great news. I think it's very important for women to do that. And even though the U.S. Preventive Task Force did do an exhaustive study, I think it's very shortcoming and short-sighted, because some of it is economically driven because of the costs. There is some burden to getting unnecessary biopsies, but I think putting women in charge of their health, especially with self-breast exam and now mammograms, I think they should consolidate and put to end to the debate that women, even at starting at age 40, should get their yearly mammogram.
I hope that this does put an end to the debate, because what the task force said, after age 50 or 50 and above. And for many women, that is postmenopausal, but there's so many cases these days that are found premenopausal.
Correct. And I think this actually goes to show why it's even more important to do that. Breast cancer found early, you have a chance of curing somebody. Found late, unfortunately, that's not. Given that situation, I don't think we can ignore any advantage we can get. As technology gets better, we're going to be able to find better tumors or smaller tumors in younger women as well.
And that's what you and I were discussing, and the fact that, I asked him, does it seem like the ages are skewing younger and younger? And you said, technology's better, we're finding it earlier.
And I think people have been getting their mammograms. And I think that shift to finding things earlier was ultimately what will help us improving mortality in people. And I think we do not need to be confusing women anymore. I think this study will hopefully put an end to it. And that way we will have people checking the breasts, getting the mammograms as their complementary studies. And I think it's simple, straightforward to do, and I think that's no reason for anybody not to get them.
But you said something there that was key, and that is checking your own breast, because mammograms alone aren't going to do it. You need to make sure you do those monthly self-breast exams.
I think that's very important, and because it puts control in women's hands. You take care of your own health, and I think there's nothing more important than that.
Dr. Chinnasami, thank you so much for taking the time to talk with us this morning. We do appreciate it.
You're welcome. Thanks,
Nice
Cindy.
to meet you.